today we're going to hear a lot about EAB and its likely impacts in Oregon. And unfortunately, none of this is going to be all that, cheery. This is going to be some pretty sad stories. That's not a criticism of anybody, it's just the nature of the situation we face. Now, I'm not going to talk as much directly about EAB, the bug, the biology of it. Rather, in the first half of my talk, I'm going to focus on tree loss from EAB and that's impact on public health. Now, this also isn't going to be a cheery story, to be fair. But having talked about the impact of tree loss on public health in the first half of my talk, I'm going to spend the second half examining the impact of tree planting on public health. So the opposite, we're going to look at tree loss, and then we're going to look at tree planting. Now this will be a lot happier story, so for those of you who get easily upset, we know we're going to finish on a positive note there. But even the part of my talk that focuses on EAB, it's really only superficially depressing. Because, yes, EAB does pose a risk to public health, a non-trivial risk to public health. Let me be clear, but why is that? Why is EAB a threat to public health? What's the underlying reason for that? Well, it's because trees have such a positive impact on our public health. And if you forget everything else I say today, remember that one thing. So that's really important here. In fact, I think health benefits are by far the most important benefit that urban trees provide. So that's quite clear in my view. So before I talk about the results of specific studies, I'd like to complain a bit about how my life is very difficult, which I'm sure you're all very excited to hear about. And it's one of the problems with the type of research I do is called observational research, right? So I just kind of look at the world and try and see patterns in data. That's how I spend my time. But one of the sort of occupational hazards of doing observational research, looking for patterns in data, is that you start to see patterns everywhere. Everything starts to have these causal patterns. So you start to believe that NFL teams with more vowels in are more likely to win the Super Bowl. Or, baseball teams with white uniforms are more likely to win on a Tuesday. And stuff like that. It's not that those patterns don't exist, they will come up now and then, but there's no true causal relationship. Why would a white uniform affect your ability to win? So how do you avoid that? How do you avoid this sort of tendency to see patterns in data everywhere? Well, one way is to have a good reason, is to really have a good reason to look at the relationship between two things before you ever collect a scrap of data. You think hard, hey, is it reasonable to think that these two things could be related? So, in the case of trees and health, is it reasonable to think that trees could affect public health? Is that something that is it a reasonable thing to do before we collect any data? Or put another way, what could be the possible mechanisms linking trees and health? And you really don't have to think about it for very long to see there's some pretty reasonable ones. For example, we know that trees can absorb air pollution, and air pollution is absolutely puts you at higher risk of a whole range of health outcomes. So there's no question about that. Now, also, if you were to make the wise decision now to go outside and stop listening to me, sit under a tree, your short-term markers of stress would go down. So your heart rate would go down, your blood pressure would go down, your salivary cortisol would go down. Another way of really saying this is I'm personally harming your health right now, so a slightly depressing way of looking at it. Another thing is that, and this may be less obvious, is that trees and greenness can really affect social connectivity. Greener neighbourhoods, people have more social connections. Well, that's nice and fluffy, but why does it matter from a health point of view? Well, because social connections are enormously important for health. Loneliness will kill you. So, green neighbourhoods, we have more social connections. We also know that in greener neighbourhoods, you're more likely to engage in exercise. And Lord knows we all get preached at that exercise is good for us. So, given these things, it's reasonable to hypothesize that trees could improve our health. So to see how a study like this would work in practice, Let's go back 12 years to my first trees and health study, and I looked at the relationship between trees and birth outcomes. Some of you may have heard me talk about this before. And why on earth would you look at trees and birth outcomes specifically? Well, one is just a pragmatic reason. There's really birth outcomes, or birth records have really great data, so we have information on the weight of the baby, gestational age, information on the demographics of the parent, that's all there. So I'm a very sort of data-hungry profession, so it's great to have all that information. And then there's a plausible story linking trees and birth outcomes. These mechanisms I just described, given just one, for example, we absolutely know that women who are exposed to air pollution are at an increased risk of having an adverse birth outcome. So there's just one way in which a tree might help. Certainly there are others. And this last one is going to get me in trouble one day. I say this as a man who's never had kids. Pregnancy only lasts 9 months. And why is that relevant? Well, I had the address where a woman lived when she gave birth. And that address tells you quite a lot about a woman's exposure to trees over the course of 9 months. Now, some women move while they're pregnant, but most are going to spend all or most of their time living at that address. So that address tells you quite a lot about their exposure to trees. You could, in contrast, let's say you had the address where somebody was living when they were admitted to the hospital having had a heart attack. What would that address tell you about their exposure to trees over the course of a disease that might go back 50 years? It tells you something, but a lot less. So the fact that, pregnancy, we know what causes it, we know when it ends, we know how long it is, it's a nice health condition to study. So the specifics of the study, I looked at almost 6,000 singleton live births that happened to women in 2006 and 2007. It was done here in Portland. And I looked at 2 adverse birth outcomes. The first is what's called small for gestational age. That's whether a baby was below the 10th percentile based on gestational age and gender. That's a big mouthful way of saying, was a baby underweight or not? So we looked at whether a baby was underweight. And then whether the baby was preterm, so simply was a baby born before 37 weeks. Now, even the most tree advocates in the room are not going to say that trees are the only or even the main reason for having a healthy or not a healthy birth. So we account for other things. Demography, we know things like race, education, income are important. So we account for those. And then we account for things like previous births. We know if a woman's had an uncomplicated birth in the past, she's more likely to have one in the future. We looked at prenatal care, distance to stuff, so good stuff like parks, bad stuff like freeways. We even looked at crime around the house, because we know that can be a stressor. So we have to take into account all that stuff, holding all that stuff constant. We looked at tree canopy in 50, 100 and 200 metre buffers around the centre of each woman's lot. So on the left there, you have a high-resolution aerial photograph, and I should say, just for privacy reasons, that they aren't women in the actual sample, so we're very careful with data privacy. So you see, you might just be able to make out those green rectangles. That's the outlines of a woman's lot, and the red dot is the centre. And on the right, we have what's called classified aerial imagery. So you take that picture, you break it into 1 metre squares, and you classify each square as either tree canopy, that's the green, or non-tree canopy, that's that sort of insipid off-white. And then I've included just the 50-metre buffers there for clarity. So what did we find? Well, we found that women who had more tree canopy within 50 metres of their homes are less likely to have underweight babies. This is kind of an interesting result. But this was the first study to look at the natural environment birth outcomes. So, hey, maybe this is just a statistical quirk. Maybe I'm not, maybe this is a white uniform winning on a Tuesday thing. Who knows? Well, since I did this study back in 2011, there was several other studies that looked at this. So in 2012, a team in Spain found that women with more greenness within 100 metres of their homes had higher birth weights. So that's consistent. In 2013, a team in Southern California found that women with more greenness within 50 metres of their homes had higher birth weights. Again, 2014, a team in Germany, greenness within 500 metres of their homes, higher birth weights again. And then finally, 2014 again, a team in Canada found that mothers with more greenness within 100 metres of their homes had higher birth weights. Now, is it possible that my study has some statistical quirks, or I just made a really bad screw-up? Yes, absolutely possible. But it's much less likely that 30 studies all consistently found the same thing. There's been 30 plus studies now of this. Now, I think we'll just take a moment to pause and think about that. Now, imagine I had a healthy weight baby in this hand and an underweight baby in this hand, assuming two mothers were irresponsible enough to give me their babies, but assuming they were, that the difference between the two is a mother's exposure to trees during pregnancy. It's a pretty profound thing. You know, that's telling us something very fundamental about our relationship with trees and how they improve our lives. Because birth outcomes are really important. If you're born underweight or premature, you're much more likely to have health problems at birth. You end up in a neonatal intensive care unit, which are very expensive and stressful places. But also, kids who are born underweight or premature, they don't do as well in school. They're going to have lower lifetime earnings. So it's really best to avoid it. And it's the possibility that you might be able to avoid some of those with trees, the retention of the planting of trees, is a kind of intriguing possibility. So that's all good, but this also highlights one of the big headaches when you're studying the health benefits of trees, and that's the nice tree, nice neighborhood effect. That is, in urban areas, where are all the good trees, where are most of the nice trees going to be? In whiter, wealthier, better educated counties. Well, neighborhoods, not counties. And we certainly know that race, education, and income are really important drivers of health outcomes. So you've got some difficult things to untangle there, because the trees that correlate with all these other drivers of health outcomes. So, you know, you try and take statistical steps to deal with that. Certainly I did, and these other colleagues of mine have. But what you can never do in this sort of work is run a statistical test that says, you run the test and says, have you thought of everything? It says, yes, you have, you're fine. Go home, you're okay. You can't run that sort of test. So you do this type of work and you end up with a sort of low-grade gnawing stomachache, because you're like, have I done this right? And about 10 years ago, I was particularly bothered by this problem when I realized I could flip the problem on its head. That is, if trees are good for you, which is my general hypothesis, right, then killing them should be bad for you. You would think one thing would follow from the other, but why is that such a grand revelation, or passes for a grand revelation for me? Well, because it opens up some new methodological approaches, because trees can die a lot quicker than they can grow. If you're interested, you can longitudinally study changes in tree cover in a reasonable amount of time. If you go looking at tree growth, it takes decades for the thing. I mean, let's face it, we're tree people, but they are tediously slow growers. You know, it's a bit kind of offensive at times. They take a long time to grow, and so it makes it difficult to study, but they can die quickly. Now, what do you think could kill trees in a short amount of time? Yes, now we're circling back to EAB, certainly the nastiest bug in the last 20 years, and so you've already seen these two pictures. Oh, hang on, I've got more of these, so I'll just skip over those, but that's what's coming for us. Of course, the bug itself is quite pretty, which is a sort of small consolation for the environmental problems it's going to cause. Now, the spread of EAB, though, does present some opportunities. It's what we call a natural experiment. So let's imagine if you had to do a true experiment, let's say here in Portland, on the loss of trees and their impact on health, what could you do? Well, you collect together all the people in Portland who have at least one tree in their yard. You randomly split that in two, and you go chainsaw all the trees down in half the yards. Right. It's a perfect science experiment, you know. You probably get shot somewhere in the first 5 or 6 yards there. So you can't actually do that. But you can take advantage of it when other things do it for you. And Emerald Ash Borer does that. And it does it with something actually nice. What's important there is the randomization. And the EAB has a nice random part to its spread. So you see it spreading here from 2002 through 2022. And you'll see there's a kind of orderly component to the spread. You know, it spreads from one county to the next, as you would imagine. But you also see these sort of random parts popping up hundreds of miles from the nearest county. So it's going to spread through again, and let's just watch. It appears in Tennessee in a few years, apparently likely at a NASCAR race. So you see that pop up. Yeah, apparently it's firewood to NASCAR, there it is. and then we're going to pop up in Boulder County in a second, right? So you have this random paths to the spread. Can you imagine another driver of health outcomes changing in this way, in this fast or this sort of pattern? So could you imagine, say, changes in median household income that would follow this? Or changes in the racial composition of counties that would follow this? No, they don't spread this way. So you have this loss of trees has a really unique pattern. And that's what makes it really interesting, because we see, okay, we've got this unique pattern of tree loss. Now let's go see if we see patterns of mortality to go with it. And we choose to look at two diseases. We looked at cardiovascular disease and lower respiratory disease. One, because they're very important. They're the first and third biggest killers in the US, so that's important. And also because there are plausible reasons linking trees and those types of diseases. I talked about in the beginning, but certainly air quality, stress, exercise, all those things link trees and cardiovascular and lower respiratory disease. Now in this case we looked at county level mortality, the black squares on this map are counties. So we looked from 1990 through 2007. So even though we did this paper in 2013, there's a big lag in death reported in the US. So what we did is we had 12 years without the bug gets added in, and then we see what happens. And what happened? Well, we found that EAB was associated with increases in cardiovascular and lower respiratory disease, highly significant. And what's also interesting is that as an infestation progressed, as more trees died, more people died, which is what you would expect. If killing trees is bad for you, you would then expect killing more trees would be even worse for you, which is indeed what I found. We also found that there was a bigger impact in wealthier counties. Why would that be? That more trees there, they're going to provide better health benefits. You take them away, you see a bigger negative health impact. Exactly what we saw. So that's, people always think I'm psychopathic when I say that's encouraging. Not encouraging from a health point of view, it's encouraging sort of methodologically that you see these relationships acting as you would expect them to. So across 6 years, we actually saw an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory. So an additional 21,000 deaths, that's not a trivial number. And when you get kind of eyebrow-raising results like this, the temptation is to, shout them from the rooftops. That is not the way to go. The best thing to do, shut your office door, try and disprove your own results. Why? Because if you manage to do that, you'll be privately disappointed. If you release them into the public and somebody does it for you, then you face public humiliation. For those of you who have experienced both, you know that one is preferable. So, unfortunately more than once in my case. So, how do I try and disprove the results? I looked at the relationship between EAB and accidental death. Why? Because there's no possible way that EAB is affecting accidental deaths. Beetles don't cause car accidents. There's no causal link, right? What plausible way could this happen? And we didn't find a relationship. So we'll call it negative control. And that's really important. So we found a link between EAB and two causes of death. It could plausibly impact, that's cardiovascular disease and lower respiratory disease. And we didn't find a link between EAB and a cause of death it couldn't impact, that's accidental death. So, this is interesting. I think, these EAB results I think are quite compelling in terms of telling you the likely health benefits of trees. But in the years since I did the study, I did wonder whether the opposite was true. Okay, we lose trees, we saw increases in mortality, but if we plant trees, do we see the opposite? Because if you could see things going in both directions, it would really increase the evidence that trees are good for you, right? So, but to do a study like that, you need years, you need decades of tree planting data because, again, the tediously slow growth rate of trees. And that's what stopped me. I talked to the city in Portland, they didn't have those sort of data. And then a couple of years ago, I was just talking to a friend of mine who worked at Friends of Trees, and she happened to mention that they had 30 years of tree planting data. What? Excuse me? I couldn't believe it. Then she just was like quite blithely said, oh yeah, 50,000 trees, the exact address and date we planted all these trees. Couldn't believe it. It was like, oh, but then they were nice enough to share it with me, which was really great. So first of all, a shout out to Friends of Trees for just being good record keepers for no particular reason. It really helps people like me. So that was wonderful. And really, that was, you know, I couldn't have done this next study without their help. So, you've got tree planting data from Friends of Trees, 50,000 trees planted in yards and, well, mostly street trees, I think about 87% street trees, some yard trees. I know that you guys have planted more trees than that, but that's, you know, wild areas. This was in yards and street trees. So then I had to go get some health data, so I contacted Oregon Health Authority, and they gave me access to census tract level mortality data. So a census tract is a unit used by the census. It's probably about 4,500 people. It's roughly the size of a named neighborhood. So we can just, for the purposes of this discussion, think of it as neighborhood level mortality. There's about 140 in Portland, which is roughly the number of named neighborhoods in Portland. So what we were doing here is, let's see, does tree planting affect neighborhood level mortality? And we looked at two tree planting measures. One, very simple, how many trees have been planted in a neighborhood in the last 15 years? Just total trees. But then we also looked at the number of trees in 3 age bands. That's 1 to 5 years after planting, 6 to 10, and 11 to 15. So we split those trees up into 3 age bands. Why? Well, because before we collect any data, we would think that as trees age and grow, they would have a bigger impact on health. Well, why is that? So, for example, as a tree gets bigger, its leaf area goes up, so its capacity to absorb air pollution. Then think about stress reduction, the sort of psychologically restorative effect of trees. If you're sitting down under a sort of 100-year-old elm tree with a big spreading, what's the word I'm looking for? Crown. Yeah, that word I've never used before. Big spreading crown, thank you. That has quite a different effect than if you're crouching next to a 2-inch sapling worried about falling over and squashing it, right? Big trees are likely to have a bigger impact on health. So we wanted to see if that was the case. And it's also important here, you should never make science too easy on yourself. Right? Don't just ask the quick question, I've got an answer I want, run away. Say, okay, if we see an impact of trees, tree plant health, that's fine. Do we see it on different types of health outcomes? Do we see that older trees have a bigger impact than younger trees? We want to really push and prod the results to see if they act in the way in which we would expect. So let's just jump straight to the results. It was a pretty simple statistical model here. We just had 5 variables in the model. So this table, very simple, don't worry. It just shows how 5 variables were associated with non-accidental mortality. Why do we look at non-accidental death? Because, as I talked about, there's no plausible way in which trees are going to affect accidental death. So we took them out of the equation and just looked at all non-accidental mortality. So what do we find? Well, we found that in wealthier neighborhoods there was less mortality. Hardly surprising. You see this in study after study. Next, we find that in neighborhoods where there was the average age was higher, you saw increases in mortality. Again, hardly, so stop the pressures that older people are more likely to die. And then we found education, better educated neighborhoods, lower mortality. Again, entirely as you would expect. We didn't find an impact of race. A couple of reasons why that might be. One, we already had income and education in the model, so to some degree that accounts for that. And then Portland just doesn't actually have a huge amount of racial variation. So, the final thing here, let's get to the drum roll. We looked at tree planting in the last 15 years. What about neighborhoods that had more trees in the last 15 years? Well, we saw it's very significantly decreased mortality. Okay, but how about the size, the magnitude of that? So, on average, Friends of Trees planted about 1,638 trees annually. That's over the 38 years. They've only planted more in some years than others. And we found that those 1,638 trees was associated with 15.6 fewer deaths a year. That's really not a trivial number in a city of 600,000. And another way to put it is it looks like, obviously these deaths, they don't make you immortal, but roughly 100 trees averted one death. Which is, that's amazing, really, when you think about that. So, what about the younger and older trees? Okay, so in this table, what we're just going to say is, let's look at, again, planting that average number of years, 1,638. So we found that 1,638 well, it's not 1 to 5 year old, but 1 to 5 years after planting. So 1 to 5 years after planting, 1,638 trees were associated with 11.6 fewer deaths. Okay, now let's wait another 5 years. 10 years after planting, 1,638 trees were associated with 19.7 fewer deaths. Interesting. Let's go another 5 years. 1,638 trees that were 11 to 15 years old were associated with 23.1 fewer deaths. So as you would expect, as these trees aged and grow, the association between trees and reduced mortality went up. So a few things really to take on from this graph. This is important, and we're also going to start to talk about what it means from a perspective of EAB. So first, the simple thing, the association between trees and reduced mortality gets bigger as trees age and grow. That means that retaining mature trees is at least, if not more important than planted trees. And that's an important message. That means, in the context of EAB, it's really best to avoid losing those mature trees, particularly in concentrated areas that are around people. So in that case, pesticide treatment may yield some non-trivial health benefits. So I think that's the take-home message there. So now, as well as looking at non-accidental death, we were interested, hey, how does this study compare to the EAB study? Because I conceived that this is kind of as a study to go with the EAB study. So we chose, let's look at specifically cardiovascular death. And this labeled the yellow line there. We found, yes, planting trees was associated, highly significantly associated with reduced cardiovascular disease. This is interesting. We looked at lower respiratory mortality. And in this case, at the 5% level, it wasn't significant. It just was at the 10%. It's kind of marginal, so we'll set that aside. I think that's mostly just because low respiratory mortality is a lot less common than cardiovascular mortality. So the sort of statistical power of the analysis, the capacity to find that relationship is a bit lower. So then, a really important one is what about accidental death? Again, we don't want to see a relationship there, and we did not find one. So to summarize, in the EAB paper, we found that loss of trees was associated with increases in cardiovascular disease. And in the tree planting paper, using Friends of Trees data, we found tree planting was associated with lower mortality. And these are two completely different studies. You know, they're both in different areas, different time. Really, the methodology was quite different. And in both, you found consistent results, which I think is really cool. And in both cases, tree planting was never associated with increases in accidental mortality. So I think that's an important take-home message. Now, because there's a lot of green health studies will look at, they'll measure exposure to the natural environment using satellite data, using greenness, for those of you who are sort of tech nerds, using often what's called the normalized difference vegetation index. When you measure it like that, it's a little difficult to do. If in this case, when you're planting actual trees, you're doing a specific thing, it allows you to do a cost-benefit analysis. So, okay, if we stick these trees in the ground, how do the costs and the benefits compare? So I did that. So what we decided to do is let's see the costs and benefits of planting one tree in each of Portland's 140 neighborhoods. So we had to make a couple of assumptions. We used the 2005 study that assumes the annual planting and maintenance cost of a tree was $58.70. We adjusted that for inflation. So $58.70, multiply that by 140, so that's $8,218. Okay, but what about, how do you value, reduced mortality? Well, the EPA runs into this problem all the time. What happens if you want to evaluate, you have say, a clean air regulation, it's going to impose costs on the energy sector, but you think it's going to save 1,000 miles, for example. Well, how would you do that? Well, there's actually a whole thing in non-market economics for valuing human life. It's called the value of a statistical life. And I won't go into the details, but the value, which is quite defensible, the EPA uses $10.7 million. That is the value of a statistical life is $10.7 million. I think I'm probably 10.8, 10.9, but you were all probably 10.7. Just saying. So in this case, if you plant 140 trees In Portland, what our model says is that will be associated with 1.33 fewer deaths. Multiply that by 10.7 million, with the benefits of 14.2 million. So the costs are 8,218, benefits 14.2 million. That's a benefit cost ratio of 1,727 to 1. So not that bad, really. You know, you see a lot of, and I think well-intentioned stuff in the urban forestry world and science where, you know, hanging price tags from trees and is it worth it? We're past that now. Except in strange circumstances, the benefits of tree planting is always going to exceed the cost. You can always find a specific example where it won't, but in 99% of the cases it will. Just be done with all that. Just put them in the ground and be done with it. Right? We're well past that point. Particularly once you start considering health benefits, it's almost embarrassing, the benefits. They're so high. So, I mean, even those Nigerian email scams used to get didn't offer 1,727 to 1 benefits. So, that's all in terms of the specific studies, but what are the take-home messages? And what does it mean for the management of EAP? So the first is trees appear to provide substantial health benefits. I want to be clear, these are associations. I haven't proved a causal relationship, so I just want to be clear about that. Oh, upside down there. And the magnitude of these benefits far exceed the costs of planting and maintenance. So that's another important take-home message. And because big trees are associated with bigger health benefits, it means that for EAB, I think you would have two messages. Try and retain those mature trees, particularly if they're around people. When you do remove trees, aggressive replanting. I think that hopefully some of the science I've showed you here supports both of those policy prescriptions and that they will be highly cost effective. So, having said that, I'm happy to take any questions. The first, I'll give you the first one. That is my dog, Georgie, the world's cutest dog. So, she had to go have some teeth out yesterday, so she hates me right now. See the little underbite she has? She doesn't have that. So, a little girl. Anyway, it's a really greatly appreciated invitation, and thanks for your time listening. I appreciate it. Excellent question, and yes, we did. So we looked at both existing tree cover and tree planting. I can't remember the number right now, but yeah, there was two things. So existing canopy cover had a positive effect on health, and then tree planting on top of that had an additional one. But that's an excellent point, because you don't want tree planting to just be a proxy for the trees that already exist. So yeah, we accounted for both had a positive effect on health. But both had a positive association on health with health. We didn't look at tree removal benefits. There's probably the tree removal costs rather. Obviously, there's people in this room who can give you a much better answer than that. But I think generally what these results are showing is that you can spend, because the benefits are so high, particularly mature trees, that it warrants spending quite a bit of money to avoid tree removal anyway. But in terms of tree removal costs, no, I did not consider that. Yeah, that's a really good question. And most of the greenhouse studies that look at residential exposure are somewhere between 50 to 500 meters. So I would guess, it's also when you start to think about the type of benefit. So if you're looking at, say, stress reduction, that's probably you probably basically need to see or exposed to the trees are quite small. Air quality may go out a little further. If you think about exercise, it may be the whole neighborhood, because you get out, you exercise in a larger area, maybe a green park nearby would have a big impact. So I think it varies depending on the particular mechanism, but I would say the 50 to 500 meters with weighted more heavily, quite heavily towards the towards the 50 meters. So partly based on science, but partly just intuition, I think the trees you can see from your house are way more important than anything else. Yeah, that's an interesting and tricky question. So there's kind of two components. One is simple. We absolutely know that racial minorities are going to live in less green neighborhoods, so their exposure is lower. So then the question is, does a given amount of greenness, is that going to have a bigger or smaller benefit? And the evidence there is really mixed. In some cases, you see, think of a birth outcome study that was done there where I grew up in England, and they found that non-white mothers derive greater benefits from exposure to greenness. But I've also seen the opposite. So it's really difficult to tell, and we're at such an early stage in the green health research, we kind of need to answer some more fundamental questions before we can start to parse out the data like that. But the ability to plant trees, other health stresses, proximity to, say, industrial pollution or proximity to highways, all those things are important. If people are facing other stresses, other health stresses not related to, because if you're living in a minority neighborhood, you're going to likely face, for example, other environmental stresses, worse air pollution, and so forth. Is greenness likely to mediate those additional stresses? Possibly. It's an interesting question we can't probably answer, but it's an excellent question. Plugging and maintenance cost, so that 58 bucks was a mean planting and maintenance. So it was, I think the planting was averaged over some lifespan. I mean, whatever, you can fiddle with the numbers, don't like it, multiply it by 10. Oh, now it's only 170 to 1. It's, the cost is so much lower. I mean, when you look at health, if you look at birth outcomes, you get a kid who ends up in a neonatal intensive care unit. The care of a single child can easily run into millions of dollars. You know, healthcare is ridiculously expensive, trees are cheap. And that's the basic bottom line here. We spend a sixth of our, I mean, human life is valuable, so we spend all this money on it. But we spend a sixth of our GDP on healthcare. What do we spend on tree care? Not that. We certainly should spend a little bit more. I mean, it's just so highly cost effective. And one of the things I know people heard me say is, I think trees are an essential part of our public health infrastructure. And I say that, and I do carefully, and it's essential in the sense that you can't easily provide those benefits another way. You can't cut the trees down and then hand out a green pill to make up for it. It doesn't work that way. So they provide essential benefits, they provide them cost effectively. So hence, I think of them as an essential part of our public health infrastructure. I did this study in New Zealand in 2018. I can give it to you, and it has two interesting things here. Both greenness, because asthma and other allergic diseases are interesting, because you can say, for example, greenness may reduce your likelihood to develop the disease, but it may provoke an attack in somebody who's already susceptible. Right? So it's a difficult thing to pull apart. So what I found there is that kids who grew up around greenness were less likely to develop asthma, and this was a cohort of 50,000 kids. The other thing's interesting, if that greenness exposure was more biodiverse, it was an even bigger effect. Because what we think there is, are any of you familiar with the biodiversity hypothesis? So you have a global loss of biodiversity and an increase in immune diseases. And we think that one of the problems is actually because of the microbes that live on the plant leaves. So maybe there may be a direct effect of the greenness, but the microbes themselves may help may help our immune systems develop properly. I also did a study, which I published last year, the year before, that shows kids who grow up in biodiverse areas are less likely to get childhood leukemia. That's another immune disease, obviously far more serious. But yes, that's the relationship between greenness and immune disease, immune development, very interesting. And yeah, I'll give you my card and send you stuff. If you just Google my name and Google Scholar, all that stuff comes up. Can we go?